Hi ladies, it's Aoife from womenshealthdublin.ie, and in this video I'm going to talk to you a little about prolapse. I'm still on maternity leave, so if Maisie disturbs the video, sorry about that. So just a quick little chat about prolapse. I want to explain it so that you understand it, but I don't want to get so scientific that I kind of lose you. So I want to try and make it as simple as I can. And what we're going to talk about here is the vaginal wall prolapses. So there's 4 different types of prolapse in the vagina, well, 5 really. So we're just going to go through them. So obviously your vagina is like a tunnel like this, okay? It has a front wall and a back wall. The front wall, in front of it comes your urethra, so that's where your wee comes out. Your bladder sits here. And then at the back wall, you have your rectum, which is where your poo passes behind you, okay? So when you are pregnant, obviously there's a lot more pressure come down on the vagina. Hormones make a difference in the connective tissue and the fascia. So there are things around here that kind of hold everything up, okay? So as well as muscles, we have all this connective tissue, and that changes during pregnancy. But obviously the weight gain and the size of the belly and the weakness of your tummy muscles and your diaphragm can't move properly. So all those things affect the vagina and the pelvic floor and what's happening down here. So for some women, they can start to get a bit of a prolapse during pregnancy, and especially towards that 3rd trimester. For other women, they might experience it after labor because, generally it'll be a vaginal delivery that will exacerbate prolapse. And then after baby's born, they start to feel more symptoms. If you feel them in the first 6 weeks, they might still well improve, just like everything downstairs, if you like. You're healing. So you might feel like your symptoms are quite pronounced, but as the weeks go on, they get better and better. Obviously, at your 6-week check with your GP or your consultant, you should mention this to them and ask them for an assessment. If you don't get the answer you want, or you feel like you want more answers and more assessments, please come and see a pelvic health or women's health physio. If we feel like you need a gynecological gynae consult, we will send you. In most cases, we don't. But if you feel like, the GP has looked but isn't maybe giving you right treatment or hasn't sent you to a physio, please come and see us. So we will need to do an internal assessment to have a little look at the prolapse. It won't hurt. What we'll ask you to do is bear down and cough and laugh, and we'll look at you lying and standing up and see what happens with the prolapse or where it's coming from. So if this was your little prolapse basically coming down from the vagina like that, if it's not out at all and it's quite high up when we look up, that's a grade 1. If it's coming to the entrance of the vagina, it's a grade 2. If it's coming out of the entrance of the vagina, it's grade 3. And if it's really out of the entrance, it's a grade 4. So we can use a POPQ, which is our outcome measure, to test this. But actually, we can just see it very easily on assessment. Is it coming out? Is it high up? Or is it right at the entrance? So if it's coming from the front wall of the vagina, it can be a cystocele. And a cystocele is coming from the bladder. So the bladder is kind of protruding through to the front wall of the vagina. Or it can be a urethrocoele, which is from the urethra. So the urethra can start to push into the front wall of the vagina. It can be a uterine prolapse, so that your uterus, which is at the very top, obviously, and the opening up here is starting to bulge down. It can be a rectocele, which is coming from your rectum, which starts to bulge into the back wall of the vagina. Or it can be an enterocele, which is actually coming from the small bowel. And that's really hard for us to know which one of those it is sometimes, rectocele or enterocele. So what can you do to help it? Constipation, avoid straining, okay? When you push down and breath hold, that really pushes a lot of the tissues down there. So at all costs, keep hydrated, eat loads of fibre, take stool softeners if you need to, and get those feet up on your squatty potty for the whole of pregnancy and after pregnancy, okay? So we really want to avoid that straining. Really want to try and avoid heavy lifting. I'm not talking about lifting your baby because that's impossible to avoid. But obviously heavy toddlers, which might have to happen. That happened to me with my little boy crying in his bed. I had to lift him out in those early days. But what you don't want to do is avoid exercise. We want to strengthen and we want to grade it. So we don't want you lifting 20 kilo today, but maybe we want to get you lifting 20 kilo in a few months. So exercise is really important. Lying on the couch, feeling upset about it is understandable, but not going to fix it. So you need to come and see the physio. Let us assess you, see what grade your prolapse is, and then we will work on your pelvic floor, give you exercises to do. If you need a pessary, and sometimes the pessaries, when we place something in here, it's like a little infrastructure or scaffolding, it just pushes it up out of the way. So it can just support the prolapse up there as you're exercising and everything. It just holds it up there. There's loads of different types of pessaries. Some you can take in and out yourself. Some that we put in and leave for a few months. So don't be scared about the sound of that. Some women just need it for a few weeks in the postpartum period and then they never need it again, or they need it just when they play tennis or go weightlifting. So again, not every physio will do pessaries, but we might advise you whether you should get one or not. And if your physio doesn't do pessaries, they can refer you to someone who does. Okay, so pessaries and exercise are the first line of treatment. And your prolapse some days will feel worse than others. Some days you won't notice it at all, and some days you will. Why? Again, holistically, fatigue, diet, exercise, there's just days that it'll be more pronounced than others. It is a quality of life thing. Women should not just have to have your prolapse, ignore it, have no treatment and live with it. Surgery is not the first line of treatment. Not every surgery is successful. We want to avoid surgery if we can. If you do surgery, it might have to be repeated. So what we want to do as physios, just like we do if you have a sore back, is keep you away from the surgeon if we can and rehab you. That's our job all the time. So let us assess you, let us rehab you. And again, exercise and pessaries, first line of treatment. And then after a few months, if we don't feel like we're getting a really good improvement, then we might see the gynae. But for most women, they do brilliant. After the age of 50, and especially women who've had babies, 50% of women will have prolapse. So if you have a small prolapse after having a baby, very, very common, but you should work on it now and not just ignore it, because maybe in later life it'll get worse just with menopause and all that. So not trying to freak you out, but some things we shouldn't just ignore them and put up with them. So moral of the story, as always, see your pelvic health or women's health physio, same thing. Go and see them, see what they say, and get working on it. And know that it is very, very common. Try not to freak out and try not to get scared and just avoid everything, okay? Because we can really help. And if you want to say it's normal, but I just think loads of women are like, oh my God, what has happened to me? Even if we knew we were going to get a prolapse, these babies are worth it, well, on the good days. But yeah, we can recover, okay? So pregnancy and childbirth is like any other trauma to the body. You've run a marathon and now you need rehab. You've got an injury, okay? I hope that helped. I hope that makes sense. I didn't want to use too much scientific terms, so I hope that makes sense to you all. Sometimes prolapse creates leakage, sometimes it doesn't. Sometimes it's just a feeling like there's a tampon in there, or there's a heaviness or a draggy feeling, or you just feel like something's there, It can be a strange sensation to even explain. It's not generally pain, but again, it can cause leakage, sometimes it doesn't, and rectuses can cause a lot of constipation issues where you feel like you just cannot get the stool out, like it's there but it's not coming out. Sometimes we advise women just to put the finger up and push it back into the back wall of the vagina to help line things up and help that poo get out. But again, sometimes a pessary can just do that, kind of straightens everything up, pushes everything, opens, fills that space, and then as time goes on, maybe all that connective tissue starts to improve and the muscles start to improve, Okay, I'm going to finish it there. That's my prolapse talk. I hope that was helpful. I hope I've debunked some of your ideas and helped a little bit of the fear side, and just get yourself to your pelvic health physio. I'm Aoife from womenshealthdublin.ie.